Welcome back to my channel. So we have a new topic for you today on Bell's palsy. So this is a disorder which usually happens in your facial nerve, because of which it leads to a lot of weakness and other issues. So let me give you more details about Bell's palsy today. So as I told you, this can lead to facial paralysis. So this is just to show you how Bell's palsy looks like. So basically you will have an asymmetric smile, okay, because of this condition, because here basically your facial nerve is getting weak, okay. So there's a weakness that is happening in your facial nerve. That might be because of various reasons, which I'll tell you later, but basically the nerve damage can lead to this issue. Okay, so asymmetric smiles, sagging face, and not able to close your eyes. Okay, so basically that the side of your face where it is drooped or sagging, that eyes is usually not closing. Okay, so there are a lot of issues which comes up with this. So basically one side of the face is usually affected, but there are certain cases where both the side might be affected, but most of the times it is one side which is affected, and because of which your smiles might be one-sided, your eyes is not closing, but incidence of this is very, very low. Okay, so like 10 to 40 people when you compare like 1 lakh people. So incidence is low, but there is a chance that this can happen. Okay, so and they've seen that pregnant women are most vulnerable to this situation compared to the normal people, because we know during pregnancy there are a lot of changes that happen in the mother, and because of which they may be more prone to infections. And during this infection, bacterial and fungal infections are also one reason for this particular disease or condition, because in the facial nerve, if you have certain infection happening or inflammation happening, that can lead to muscle damage or nerve damage there. So that is leading to the problem. So in America itself, every year approximately 40,000 people have this issue of facial paralysis, also called as the Bell's palsy year. Okay, so basic causes of Bell's palsy are all these. So it can be because of infection, as I told you, because of viral infection, bacterial infection. So if it is a bacterial infection, it is called as the Lyme's disease. So viral infection can lead to again the damage to the nerve tissues, which can lead to problem. Inflammation of the nerves of the facial. Okay, so basically the nerves which are there in your face, those are having issues either because of infection or because of inflammation. So this is the major causes because of which it can lead to Bell's palsy. Apart from that, if you have had a head trauma recently, that can lead to damage to your nerves there, which can lead to problem. And even they have seen that people having stroke issues and even people who are having head and neck tumor, even they are vulnerable to these kind of facial paralysis or Bell's palsy. So there are various grades in this again. So based on the grade, just to show you here, grade 1 to grade 6, the severity of this disease or this condition will basically increase as you move from grade 1 to grade 6. So grade 6 is the most severe condition, whereas grade 1 is the least severe condition. So the severity can vary from grade 1 to grade 6. So coming to the symptoms of this. So basically I told you the partial or mild weakness of your facial nerves that can lead to this failure or the paralysis in that area. One more thing is your facial drooping. Okay, I showed you that sagging face, right? So that kind of facial drooping can happen, because of which your expressions, facial expressions cannot be understood properly. That will be difficult. And you cannot close that eyes. Okay, so basically which side you have that issue of drooping, the same eyes, same side, the eyes cannot be closed. Okay, so that is why it leads to a lot of issues. Apart from that, because you have that weakness in that area, your mouth, one side of the face is sagging, you have drooling issues. Drooling is nothing but you have excess salivation that can happen. This can be severe cases like case 4, case 5 or stage 4, stage 5 as I showed you. There this kind of drooling can happen, but stage 1, stage 2 you may not have so much of drooling. Apart from that, you may have pain in your jaw because you have that nerve issue there, because of which the jaw might pain. You may have pain in your ear area also, because we know it is all interconnected there. Your face and ears are interconnected, so there again you can have pain. Certain times even you may be sensitive to sound. They have seen that these people who are having these issues, they are very sensitive to sound, so that can lead to problems to them. Headaches can be there. They can have loss of taste, and salivation we already spoke about. Apart from that, since we cannot close your eyes there, you can have a lot of tearing. Okay, so tears can come, and even you can have damage to your cornea because your eyes is not closing continuously, your eyes is opening in that side, which can lead to damage to your eyes, cornea basically. And you may have difficulty in swallowing because your entire one-sided face is drooping, because of which you may have difficulty in eating or even difficulty in chewing and swallowing. So coming to the risk factors, I already told you that pregnant women are more vulnerable to this particular situation. Apart from that, if you are suffering from some upper respiratory infection, the infection which is there can, the bacteria or virus which is leading to a lot of infections there can enter the facial nerves, and that can lead to complications. Apart from that, you have they've also seen that people who are having diabetes, blood pressure, obesity, these kind of issues, there also the chances of Bell's palsy is more. And it can be genetic also, it can run through families. So they've seen this condition even in children. This is just to show you how it can look. Okay, so this can be congenital or it can be acquired. So basically congenital means various reasons for that or causes for that can be like trauma. So if you have high birth weight, if you have had a forceps delivery, during the delivery, if there are during the forceps delivery, if there has been some damage to the head region or the facial region, that can lead to damage to the nerves there, which can end up with this Bell's palsy. Premature delivery, and certain times they've seen even birth due to C-section can lead to this complication. So it is not that every time any forceps delivery happens or C-section happens, it can end up with Bell's palsy. This is just to tell you that these can be some reasons for Bell's palsy to happen, because during this, if there is any damage that is caused for your head region and the facial region, that can lead to the damage of the nerve, which can lead to Bell's palsy. So even they've seen that people who are having craniofacial abnormalities like lip dysfunctioning, so it looks something like this. So even those people are more vulnerable to this Bell's palsy. So this is how a lot of advancements is happening now, and even craniofacial abnormalities, they have done a lot of work there, and you can make your lips proper here. So there are a lot of studies going on in that area also, and genetic, as I told you, can also be a reason for your Bell's palsy. So coming to the mechanism, what happens here, I told you the facial nerve is running through the face. So this is yellow thing, can you see here? So this is something, this is your facial nerve. Okay, so it will be running through your face through a narrow canal. Okay, a bony canal will be there. Through this narrow bony canal, this nerve will be running. So if there is any infection happening in this area, what happens is this nerve will swell. Okay, swelling can be there, which can lead to damage to this nerve, because the narrow canal is there and your nerve is inflammation is happening to the nerve. It can lead to complications there. So because of this inflammation that is happening, that can lead to issues. And that apart from that, they've also seen that if there is any skeletal abnormalities or trauma, so maybe accident might be a reason, so that can lead to disruption of the relationship. So there is a proper relationship, like your nerve is within the bony canal, and if it is in proper place, there's no issue, your face will be normal. But what happens is when there is trauma, when there is accident, there's a chance that your bone will get damaged, and once your facial bone gets damaged, it hits the nerve, and the impact of that will have a negative impact on the nerve basically. So nerves get damaged, and because the nerve is damaged, your entire face can become paralyzed. So this is the mechanism what happens. So when should you see a doctor? So basically you need to see a head and neck surgeon. So these are the specialists who can help you with Bell's palsy. So if you're having an issue with facial weakness, you're having drooping, you're having excessive salivation, you cannot smile properly, you feel that your smile is one-sided. So if you have these issues, then it's better you consult a head and neck surgeon. So coming to the diagnostic options, usually they have CT or MRI scan done. So this is basically to rule out if they have any tumor or skull fracture. Apart from that, they might do a physical examination. They may ask you to move your facial muscles, close your eyes, because we know that the side which is affected, you cannot close your eyes in that region. So we may ask you physically, doctor may ask you to close your eyes, lift your eyebrows. Even the eyebrow lifting cannot be done because it's completely sagging in one side of the face. So that is why they may ask you to lift your eyebrows and show, and this kind of physical examination can be done by the doctor. They may ask you to smile, show your teeth. So these are some things, okay, just to tell you that. So in this way, based on your facial expression only, they can get to know if you have this issue. Apart from that, they may even do something called as EMG, electromyography. Okay, so basically this is how it is done, just to show you. So it can be done for normal person also, and if it is done for normal person, you can see this basic signal. Okay, so EMG signal you can get. So if you compare it with the normal person signal and a person with Bell's palsy, there will be variation in the signals. So based on this variation in the EMG signals, you can identify if a person has got Bell's palsy or not. Apart from that, they even do certain times blood test. We know that blood test usually speaks a lot, right? So using blood test also you can find out if you are having this issue, because Lyme's disease, so this is a tick-borne disease which usually causes because of bacterial infection. So if this bacterial infection has happened in the face region, you will have elevated immune response. So your IgG, IgM elevation happens, and that can lead to your facial paralysis, one-sided. And apart from that, they have seen that in blood test you can even find out if you have elevated CRPs, that is called as C-reactive proteins. More the amount of C-reactive proteins, it is an indication that you have some kind of infection. So because of infection, that might be a reason for your Bell's palsy. So this is how, using these kind of diagnostic options, you can try to identify if you're having this particular issue. So coming to the treatment options, you have corticosteroids. So these kind of corticosteroids are usually anti-inflammatory. So we know what is inflammation. So basically swelling, so those kind of inflammatory signals. So anti-inflammation means to avoid this kind of inflammation. So if there is no inflammation, there will be no damage to the nerve. If there is no damage to the nerve, you may not end up with Bell's palsy. So keeping this in mind, they have a lot of corticosteroids which will be suggested by the head and neck surgeon. Apart from that, they may use certain antiviral drugs if they feel that virus infection or virus has led to this complication. Antiviral drugs can help in preventing these kind of viral infections. Apart from that, physical therapy also is coming up now. Like they may go for alternative strategies like acupuncture using needles. Okay, so I've made many more videos where I've told about acupuncture. You can watch that for more details. So in that way, acupuncture also can help in stimulating your nerves and muscles to function better. And biofeedback training is also one more strategy which people are working on. Okay, so where you train your brain how to work. So there is a few research that is happening in finding out surgeries in the area of eyebrow lifting, eyebrows, basically eyelid lifting, facial implants and nerve grafts. So these are few options that are available. So coming to the takeaway messages, we have seen basically identifying this is the issue. So if you can identify this at initial stages, you can think how to come up or come out from this situation. So it rarely affects both the side of the nerves, as I told you, but usually it is seen that it is one-sided. Okay, so this is a picture to show you that this was a recent case where a new delivered mom, okay, so she had this issue. So she had this temporal facial paralysis, and that is why she's trying to create awareness about this particular issue, so that no more she feels like no more people should have this issue. So that is why she's trying to create awareness about this. And we also have seen that it is not something to do with age, it can happen even in children's. So you have to take care about this particular issue. So please don't forget to take care of yourself. So these are the references which I used to make this PPT for you. So thank you for watching. If you feel that this video is worth liking, please like my video. Please subscribe to my channel and please share this video with maximum people, so that if anybody is having this issue with Bell's palsy, this video will be of some help to them. Thank you so much for your support till date. Have a nice day.